Hong Kong is one of the most exciting countries in the world. Unfortunately, the cost of healthcare in Hong Kong can be really expensive. If you live in Hong Kong and you are a permanent resident, or in fact a resident with an ID card, you can use the government system. But the government system is not always appropriate. The private healthcare system in Hong Kong is the second most expensive in the world after the United States. Our job as health insurance brokers, and we've been a broker in Hong Kong for almost 15 years advising on health insurance, is to get you the right plan. There are lots of things to think about. Health insurance is in fact very complicated. There are lots of different types of levels of cover, and the policy wording and the details are very important. Is an inpatient only plan right for you? Do you need outpatient coverage so that you can access GPs and specialists? Do you need maternity coverage? To give birth in Hong Kong can cost anywhere up to $20,000 US, and that's without complications. So making sure you're covered for that level of maternity care is really important. We can also advise on optical or dental issues, evacuation and repatriation. Although you're unlikely to be evacuated from Hong Kong, if you were travelling in China and something happened, for example a car accident, then you need to be evacuated back to Hong Kong. Repatriation would mean you could go back to your home country, Australia, UK, America. Two other very important issues which we can help and advise on are pre-existing conditions and chronic conditions. Pre-existing conditions are difficult to get covered, but it can be done. So if you have a pre-existing condition that you want covered by your health insurer, let us know and we can get that covered for you, or we can certainly find out if it's possible to cover it. Chronic conditions are something that are poorly understood but are very important. Chronic conditions are conditions that once you have, you never recover from. You just manage and maintain. Good examples would be heart disease and diabetes. Insurers basically don't like these conditions because they're very expensive and they last forever. They don't go away. As such, choosing a plan with chronic condition coverage is very important, particularly if you're in your 40s or 50s or 60s. These are the types of conditions that are sometimes referred to as lifestyle illnesses. Basically, they don't often occur when you're in your 20s or early 30s, but as you get older, chronic condition coverage is really important. Our job as a health insurance broker is to help and advise you. So, if you're looking to buy health insurance or you're not happy with your current plan, then come and talk to us. We'll go through your needs, look at all the options available, and help you get the right coverage.